Transvestism is characterized by a strong desire to wear clothing typically associated with the opposite sex. In contrast, tardive dyskinesia is a condition that causes involuntary and excessive movements such as blinking, tongue movements, and even unusual sucking and chewing motions. To manage the extrapyramidal side effects of certain medications, drugs like trihexyphenidyl, Artane, and benztropine, Cogentan, are often prescribed. For patients taking monoamine oxidase inhibitors, MAOIs, it is crucial to avoid certain foods and beverages, such as aged cheese, caffeine, beer, yeast, chocolate, liver, processed foods, and monosodium glutamate, to prevent a potentially dangerous hypertensive crisis.